This PowerPoint will look at the PICO question that I researched throughout this class, which was in youth athletes suffering from a concussion, how does physical and cognitive rest compared to active rehab affect symptoms during the first week post-concussion? So what is a concussion? According to the CDC, it's a type of traumatic brain injury caused by a bump, blow, or jolt to the head and causes the head and brain to move rapidly back and forth, which can then lead to chemical changes and stretching and damaging of brain cells. So the significance of concussions, there's a wide range of symptoms that can be short-term or long-term, including changes in thinking, sensation, language, and emotion. Up to 3.8 million concussive injuries in youth related to sports occur each year, and that's just in the United States alone. And repeated concussions can cause several deficits and can at times even be fatal. Concussions are one of the most difficult athletic injuries to diagnose since you can't see them, and there's just so many different variations in clinical presentation. There's no gold standard for diagnosing or treating concussions, which obviously makes it that much harder, and research is lacking among the youth population related to concussions. The CDC created a program called Heads Up, which provides information and allows people to learn how to recognize and respond to a concussion, and provides recommendations on when to return to school and sports. Offers information about concussions to coaches, parents, and athletes involved in youth sports, and all of their resources are free. And the goal of the program is just to protect kids and teens by raising awareness to improve prevention, recognition, and response to concussions. So the first article I looked at was a systematic review that looked at the research on rest and return to activity. It examined how physical and cognitive rest compared to active rehab affected the severity of symptoms and the length of recovery time following a sports-related concussion. So they used several assessments throughout the study to gauge recovery. The first one was a total symptom severity score, which looked at factors such as symptom duration, neurocognitive function, balance assessment, and the patient's return to baseline. The next one was the activity intensity and cognitive activity scales, which both range from 0 to 4, and they just measured the level of activity the participants had throughout the study. The Buffalo Concussion Treadmill Test, which measures activity intolerance and was used to examine how long it took patients to return to activity without experiencing symptoms. And then the big one is the Zurich Return to Play Guidelines, which is actually used by a lot of major athletic organizations today, and it just has 6 stages that they progress the athletes through, ranging from like normal daily activity to full-on game competition. So after looking at this research, they found that prescribed rest caused significant improvement in cognition as well as a reduction in symptoms. In an initial rest period, usually 24 to 48 hours, resulted in better outcomes, but they did see that too much rest for too long could potentially delay recovery and worsen symptoms. It also showed that rest is very underused by healthcare providers among youth athletes. The next study was a randomized control trial that looked at the benefits of strict rest after a sports-related concussion in the PEDS population. So it split the participants into 2 groups, either a strict rest group for 10 days, literally nothing, just rest, or the recommended rest group of 24 to 48 hours. So they used 2 tests as well, the immediate post-concussion assessment and cognitive testing, also referred to as IMPACT, and then a post-concussive symptom scale. So at the end of the trial, they found that greater than 60% of patients in both groups experienced symptom resolution, but it took the strict rest group 3 days longer on average than the recommended rest group. The strict rest group reported higher post-concussive symptom scores and performed worse on the IMPACT testing over the course of the 10-day follow-up period. So in conclusion, they found that strict rest for 10 days did not improve symptoms, neurocognitive status, or balance outcomes. And incorporating active rehab monitored by a healthcare provider after a short rest period was actually shown to improve outcomes more effectively. So limiting activity within the PEDS population may also interfere with symptom reporting because they're going to lie if they're fear of missing out on any sports or school. The last article I used was a qualitative study that looked at lived experiences of adolescent athletes following a sports-related concussion. So they found that the concussion caused major effects on their daily routines due to symptoms. It impacted their emotions, affected their ability at school and their social role, and also led to minimizing and masking symptoms. Participants also said that symptoms inhibited them from engaging in normal daily roles, which led to increased emotional issues. And they most often masked symptoms so they wouldn't feel different than peers, be made fun of, or be withheld from any activity. So improving nursing practice. With no gold standard of care, following the most current recommendations is widely used among healthcare providers, which this includes the initial rest period of 24 to 48 hours. It has proved to be helpful in the recovery process and decrease symptoms in a shorter period of time, while too much rest has proved to be detrimental to recovery and prolonged symptoms. And then also just providing a detailed care plan with strict guidelines and an expected timeline might be helpful. It may increase compliance among the PEDS population so they have a general idea of what to expect and just the importance of following the care recommendations. And providing information and just reiterating the fact to parents that it's very important to get your child looked at if you think they've suffered a concussion. So nursing intervention would just be incorporating a baseline concussion assessment into annual checkups. It just gives the healthcare provider information to gauge patients off of if they do suffer a concussion. And this can just be like testing cognitive status through memory or attention tests, a balance assessment, or some kind of reaction time test. And then always require a reassessment and clearance from a healthcare provider before returning to sports. And then just have information available for parents on signs and symptoms to look for. So healthcare environment, this information would be useful in would be either school nurse or primary care providers, since they're the ones that usually do the physicals that are required for kids before they play in sports. And it just gives them, again, a baseline to look at if a child does get injured, and it just allows them to use the most up-to-date data.